So when is it that you have a patient that needs to go further for concussion management? Concussion nowadays is something that we're all familiar with, changing all of the time how we recognize and manage concussion. We've learned so much in the last 5 years about it, but it's a common problem. We see a lot of young, active people. Sports really is an important part of our lives, and anytime you're involved in a sport, you're at risk for concussion. Anytime you're involved in climbing, swimming, diving, any of the things that keep us healthy and active, we're at risk. When is it really worrisome? Well, I think that it's critically important to realize that one of the things we've learned about concussion is that if we intervene early and start managing early, we can actually shorten the course for many of our patients in terms of their symptom load. If there is any alteration in consciousness, any change in orientation, momentary confusion, a lot of my football athletes, for instance, will not remember the next play. Anything like that is a subtle sign of concussion. People don't have to lose consciousness to have a brain injury. So if there's a mechanism and a change in that level of consciousness or change in sensorium, it's time to think concussion and pull them away from the activity for the time being. The other things that can come along with concussion that can be very subtle unless you ask your patients are things like changes in sleep pattern, changes in moods, concentration issues. A lot of people will find that they're having trouble listening all the way through the math class or reading all the way through that article in the Times that they're used to whizzing right through. Those are very subtle problems that are very real signs of brain dysfunction. Anytime those things occur, you really need to step back, maybe get those patients to somebody who has some experience in brain injury. The vast majority of these people are going to get better with a little bit of physical and cognitive rest and time. The danger that we see in returning people back to their sports and physical activities too quickly is that it extends the amount of time that it takes for concussion symptoms to resolve. For adults, the other part of this puzzle is realizing that if we return someone who's a functional employed adult back to work too soon, those signs of concussion can be very subtle. They can get into trouble with job performance, which can lead to problems with depression and a lot of other socioeconomic implications of that problem. So intervening early is important. Obviously, if someone has a prolonged loss of consciousness, more than a minute or two, you need to be thinking very seriously about getting that person to the hospital. Seizure activity is another time that you go straight to the emergency room. Any symptom of weakness or numbness that's significant on one side of the body that lasts for any length of time is another indication that you might be dealing with something more serious than a concussion, and that needs to go to the emergency room quickly.